Were you aware that heart disease kills 1 in 4 women in the United States? Did you know that 64% of women who die suddenly suffered no previous signs or symptoms of heart disease? Just because you are not showing any symptoms does not mean you are not at risk. I work on a cardiovascular floor in the hospital and have become passionate about educating women and bringing awareness to heart disease. I'm here today to inform you of the various causes and risk factors, symptoms, preventions, and treatment options for heart disease. Let's start with causes and risk factors. The most common cause of heart disease is the narrowing or the blockage of the arteries that supply blood to the heart. This is commonly called coronary artery disease. This happens slowly over time and is one of the main reasons for a heart attack. Damage to the arteries can be due to an unhealthy diet, being overweight, or having other medical conditions, especially smoking. Several other medical conditions include high cholesterol, high blood pressure, or diabetes. Do you know your family medical history? Do you know if anyone in your family has suffered from heart disease or had a previous heart attack? It's important to know your family history so you know whether you are at risk. The chances of developing heart disease is strongly linked to family history. It's important to know the medical history of your parents and your grandparents so you know if you are at risk. So what are some of the signs and symptoms of heart disease and how is it diagnosed? Some of the main signs and symptoms in women are shortness of breath, nausea, and extreme fatigue. Other serious symptoms are chest pain, neck pain, jaw pain, and upper back pain. Weakness in your arms and legs are also another sign or symptom. The diagnosis of heart disease is based on your history, your lifestyle, your family medical history, and your doctor can help you determine if you are at risk. There are various tests and procedures that can be done to determine if you have heart disease. Some of these tests include an EKG, which monitors the rhythm of your heart, or it can show damage to your heart from coronary artery disease. Blood work is also another test that can be done, which measures the fat and cholesterol in your blood that can show that you are at risk. Another procedure that can be done is stress testing, which can tell how strong your heart is when your heart rate is increased. Ultrasounds, chest x-rays are other examples of tests that can be performed to help diagnose heart disease. Abnormal values in lab tests and blood work can help determine if you have heart disease. This is why it is extremely important to talk to your physician about your lifestyle, your past medical history, and your family history so he can determine if you are at risk for developing heart disease. What are some of the ways that women can prevent heart disease from happening to them? There are many ways to reduce your chances of developing heart disease. One way is to monitor your blood pressure. This can be done at any pharmacy on an automatic machine for free. Diet is key. A healthy diet is key to a healthy lifestyle. This includes a variety of fruits and vegetables, lean proteins, low-fat or fat-free dairy products, and whole grains. A healthy diet is also low in sodium and refined sugars. Making smart choices with your nutrition can help control your blood pressure, can help control your cholesterol, and maintain a healthy weight. If you are diagnosed with heart disease, what are some of the treatment options that are available to you? Lifestyle changes, medicines, and certain procedures can be done for treatments. Changes in diet, exercise, limiting your alcohol intake, not smoking, or quitting smoking are some of the few examples of lifestyle changes. Depending on the type of heart disease that you have, will determine which surgery or procedure is best for you. I hope that this information was beneficial to you and you have learned more about heart disease in women. Ladies, it's time to get educated about this serious disease that is the #1 killer to us. Continue your healthy lifestyle as is, or make small changes step by step and slowly to your health so that you will not be the next statistic of heart disease.